to MBBS Declaration Ceremony. Please be upstanding to welcome the academic procession into the hall.
Ladies and gentlemen, just first to start, acknowledgement of country. We acknowledge and pay our respects to the Kaurna people, the traditional custodians whose ancestral land on which the University of Adelaide's campuses at North Terrace, Waite and Roseworthy are built. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to land and cultural beliefs. So welcome everyone, to graduates, to families, to friends, colleagues, special guests, the Honourable Chris Picton, Minister of Health and Wellbeing, South Australia. Congratulations, guys. You should be very proud of yourself. It's the end of a very long journey. I know how difficult that has been. And I'm sure your families and friends are very proud of you, and certainly at the university and your ex-teachers, we are very proud of you. So tonight is a celebration of your achievements, and for a few of you, we also acknowledge the kind of exceptional performance that some of you might have had. But perhaps more importantly, what we're here for tonight is to acknowledge what it means to be a doctor. And in case you have any doubt, it is to serve the people and to serve the community. So you'll have, I'm sure, a rich and rewarding career, and you will have many different things that you will try, and I encourage you to do that. But at the end of the day, you're here to serve your patients, and please remember that you are the advocate for their well-being, and sometimes you might be the only advocate for their well-being. So please remember that as you go on forth in your journey. So it is my pleasure to welcome today, everybody, the guest speaker for this evening, the Honourable Chris Picton, the Minister of Health and Wellbeing in South Australia. And Chris has kindly agreed to address you this evening. Thank you, Chris.
Well, thank you very much for having me. And firstly, I acknowledge as well that we meet on the traditional lands of the Kaurna people and pay my respects to elders past, present and emerging. And I acknowledge all the very important people who are here today. You could notice us by the fact that we walked in a procession and are all sitting up the front in funny gowns and hats and things. But it's fantastic to have all of the very senior people from the profession, but also at the university here to congratulate the new graduates. And I acknowledge particularly Dr. Michelle Atkinson, the President of the AMA, for being here, and also Professor Danny Liu, the Dean of Medicine and Head of the Adelaide Medical School, for being here. But particularly, I want to thank and congratulate all of the graduates for your incredible efforts that you've gone through to get to this point in your career. A significant amount of study and hard work and blood, sweat and tears has gone into being part of here, and I hope that you can now bask in the glow of that achievement a bit and acknowledge what a tremendous work that you've done. But also want to acknowledge all of your family members who no doubt have supported you on this journey to get to this point as well. I do feel like a little bit of an outsider, because dare I say, I did law rather than medicine, but I don't know if it's that or that I went to Flinders rather than Adelaide. But please don't hold that against me tonight. The good thing is that you get to graduate in this amazing hall, whereas at Flinders we graduate in the gym that's dressed up a bit nicely with curtains and things. So this is much grander. Look, events such as this really provide a great opportunity to recognise the key contribution that you will make, and you have already made, to South Australian healthcare system and the people of South Australia, and ultimately the consumers and patients by providing exceptional care to them. I want to congratulate you on all of your accomplishments and especially acknowledge your resilience and the achievement of completing your studies through the course of a pandemic, which I'm sure no one appreciated or could have considered when you started those studies. The intern year that you're about to embark on is the transition from being a medical student to a medical practitioner. It provides the experience of applying the theory of the treatment of patients as a responsible professional. And as you now graduate from and transition into the internship, I encourage you to take every opportunity available to you to get the most out of that experience. The profession that you're entering into is certainly not an easy one. All of you have had to skills that you've embarked upon. There'll be a number of different career trajectories that you will take, but you've all made the active choice to enter this most esteemed profession. It's a profession that you have entered not because of the pay, not because of the simplicity, not because of the work-life balance. It's a profession that you've entered because you care and you want to make a difference. And I look forward to seeing the contributions that you will each make to looking after the care of South Australians. And hopefully, as part of the fine print, Danny, we've put in your graduating certificate that you all have to stay here in South Australia for your entire career. Certainly from my perspective as the Minister for Health, I have had the privilege of meeting so many of our doctors across South Australia and hearing from them of their experiences and seeing so many of the incredible developments that they're undertaking in terms of patients' care. While, of course, opinions across doctors may vary, sometimes greatly at times, and while the interests are diverse, I've found doctors to be united in their passion for what they do each day, improving the lives of South Australians. You are going to be at the very heart of our health system, and you'll be among the fiercest voices for positive change. Your expertise, your experience and your advocacy is what will drive reform and ultimately higher quality care for your patients. We have committed to increasing the number of resident doctors across our public hospitals because we understand how important that is to have additional people providing that care and also to ease the burden on our junior doctors in the system. And we're delivering on that commitment already. We'll be working in partnership now with clinicians on long-term planning for the long-term workforce needs of our state, and you will be the ones who will be there for the long term, and that is clearly very important to you. But we know that the commitment to doctors goes beyond a commitment for just additional staff. We know that you need to be supported in your work and training, or ultimately the system will suffer. We're committed to supporting you in the system, to making sure you have the support and the tools you need to perform at the top of your game, and that your colleagues are well supported to guiding you along the way. South Australia, as you know, is a great place to work and study, and we'll do all that we can to ensure that you have a strong pathway in our healthcare system here in South Australia, no matter what turn that may take. And that may well be in one of our public hospitals, it may well be in the private system, but importantly as well, it's worth highlighting the importance of regional practice and general practice to our healthcare system as well. I'm proud that we are now delivering more investment into our healthcare system to make it a more rewarding place for patients to receive good quality care. And I look forward to working alongside you in the years ahead and to see the positive contributions that you will make to our healthcare system. As advocates, both for your individual patients and to the system as a whole, my door will always be open and your ideas will be welcome on how we can improve our system. So congratulations to you on completing your studies. Congratulations to all of the award recipients that we're about to see, both students, teachers, who've contributed to your success. And as I said, all of the family members who no doubt have made many sacrifices to make sure that you can be here on this day at this special moment. So thank you for the opportunity to speak with you. Congratulations, and I look forward to seeing your journey as leaders in our healthcare profession. Thank you.
Thank you, Chris. And because you're a law graduate from Flinders, we're going to make you do some work tonight. So Chris is very kindly going to present the first batch of awards, everybody, and this is the really pleasurable bit for us. So a series of prizes, and if your name is called out, please come up. So firstly, the Ian Furler Prize in Obstetrics and Gynecology, awarded to the Year 6 student who achieved the best overall in a structured Viva examination in Year 5, and the recipient is Andrew Tong. I worked with Andrew in the wards earlier today. Well done, Andrew. The Ruth Highway Memorial Prize and Medal, and this is awarded to the student who achieves the highest marks in the Year 5 examination in human and reproductive health from the long case Viva and the end of term OSCEs. And the recipient is Catherine Jenkins. Well done, Catherine. Now we have the Royal Australian and New Zealand College of Obstetrics and Gynecology Women's Health Award, and established in 2005. This award is in recognition of an outstanding obstetrics and gynecology med student in Year 5, and this year's recipient is Ven Wu. Well done, Ben. The H.K. Fry Memorial Prize in Psychological Medicine is awarded to the Year 6 student who gives the best presentation on a psychiatric topic which is undertaken as a component of the Year 6 psychiatry attachment. And the recipient this year is Muhammad Manji. Well done, Mohammed. The Sir Trent Champion de Crespigny Memorial Prize, I apologise everyone, is awarded to the Year 6 student who obtained the highest marks in the Year 5 end of year clinical examination, and the recipient is Sean Liu. It's a magnificent surname, Sean. The Keith Sheridan Prize is awarded in Year 6 to the student who has attained the highest overall performance in the Year 5 clinical attachments and the end of Year 5 examination, and that is Isabella Vinci. Congratulations, Isabella. Next up, we have a prize in paediatric surgery and medicine. It's an awarded in Year 6 to the student with the best performance in Year 5 paediatric surgery and medicine. And we have two recipients this year, couldn't be split. And they are Christy Gudas and Georgina Trotter. Well done, Christy. Well done, Christy, Georgina. The Barbara Mailer Memorial Prize is awarded to the student in the 5th year MBBS program who gains the highest marks in the essay on child and adolescent psychiatry, which is undertaken as a component of the assessment in paediatric medicine. Unfortunately, the recipient is not here today, and that's Hui Dap Pham. Minister Chris Picton, we thank you for coming tonight and fulfilling your duties, presenting 2 awards. Thanks very much, we appreciate it. Could I please invite Dr. Thomas Gransbury to the stage, please, to present the Everard Prize. Thanks, Thomas. So the Everard Prize is named after William Everard, who sat on the very first Adelaide Uni Council and whose dad was one of the first 4 doctors to arrive in South Australia in 1836. He's survived by his great-great-great-grandnephew, recent graduate Dr. Tom Gransbury, who we're very happy here to have to present this award. Thanks very much, Tom. It's awarded annually since its inception in 1889 to the final year student who finishes one of the top 4 students in Year 3, and then subsequently in Years 4, 5 and 6, and obtained the highest overall performance in the Year 4 and the Year 5 examinations and the Year 4, 5 and 6 clinical attachments. It's very high achieving, clearly, and the awards for outstanding effort in obviously the last 4 years of the program. And we've seen her on stage already is Christy Gudas. Well done, Christy. Thank you, Thomas. I'd now like to invite Dr. Richard Hea, who's the Executive Committee member of the Australian Chinese Medical Association of South Australia, to the stage to present the ACMA Prize. And this prize is awarded to the student with the best overall result in Year 6. Thank you, Richard. And the recipient is Kara Nimon. Well done, Cara. Thank you, Richard. My great pleasure now to invite the outgoing president of the AMSS, everyone, Tiham Ahmed, to present the student awards to the staff. I found a little something about Tiham today. He was late paying university fees, so not going to graduate this year apparently, Tiham. We'll make an exception for you, mate. Come, Tiham.
Throughout their time at the Adelaide Medical School, students are fortunate to receive invaluable teaching from clinicians, registrars, junior doctors, and SA Health staff, often out of the generosity of their own time and without remuneration. The Adelaide Medical Student Society Teaching Awards acknowledge the generous contributions of these teachers and mentors to the learning and growth of students throughout the medical program. There are 4 awards that are presented annually on recommendations from student feedback to preclinical, clinical, and rural teaching, with the final award specifically for registrars who teach into various levels of the program. The winner of our first award, the Richard Pellew Prize for Preclinical Teaching, is unfortunately unable to join us today. However, the many nominations for this individual speak for their passion for teaching and the impact they've had on many students in the preclinical space. Would you please join me in congratulating Dr. Nikhil Taminetti. Our next award is the Mark Bonin Prize for Clinical Teaching. The recipient of this award is known around the medical school for their engaging, enthusiastic, and informative teaching across all levels of the school, as well as their infectious passion for their field. Congratulations, Professor Saper Shakib. The next award is the Registrar Teaching Award. The winner of this award has made an impact through the initiative they've taken in providing regular tutorials whilst balancing the busy schedule of a registrar. Would you please join me in congratulating the winner of the Registrar Teaching Award, Dr. Michalis Koulouros. Our final award is the Rural Teaching Award. The recipient of this award has been a persistent presence in the Adelaide Rural Clinical School and her passion and commitment to advancing rural education is well known to the students, particularly the fifth-year students. Would you please join me in congratulating the winner of the Rural Teaching Award, Dr. Lisa White.
Thank you, Tiham. Tiham and to the rest of the AMSS, for me personally, I really enjoyed working with the AMSS. It was an outstanding experience. It was a nice way for the first year of my role to have such a great team to work with. So now I take pleasure in welcoming Dr. Jarrett Hopkins, who's the chair of the Adelaide Medical Students Foundation Board, to present the Intern Teaching Awards. Thank you, Jarrett. So the Intern Teaching Awards. So the AMSF is an independent organisation led by students and graduate doctors from the Adelaide Medical School, which exists to serve and support the Adelaide medical students in the form of various prizes, scholarships and grants, 2 of which will be presented tonight. So Good to go, Jared. For this Student Teacher Award. So this award recognises the outstanding culture of peer education and mentorship within the Adelaide Medical School, as nominated by students, and is awarded to the final year medical student who exemplifies these efforts to educate and mentor students. And this award goes to Nisha Sukeja. Thanks, Nisha. Well done. So now for the Intern Teaching Awards, and these are 3 awards that are given to outstanding teaching by interns to medical students, awarded to an intern from each of the major teaching sites after nominations by students and selection by the medical committee at each site, and its approval by the AMSF Board of Directors. So firstly, from the Royal Adelaide Hospital, the Intern Teaching Award goes to Shashani Gunasekara. So I had said there were 3 awards, actually 4, because there's 2 going to the Queen Elizabeth Hospital for Intern Teaching Awards, one of whom unfortunately can't make it tonight, and that's Ben Goltz. But Holly Moran is the other recipient from the Queen Liz. Thank you, Holly. Now from the Lyle McEwen Hospital, and recipient for the Intern Teaching Award is Nicola Hayward. Well done, Nicola. Thanks, Jared. Thank you. It's an opportune time for me to thank on behalf of the medical school and the university more broadly for the amount of teaching that's actually delivered by our partners in the health sector, without which our program would nowhere be near as high quality as it is. So for me personally and from the medical school, thank you everyone for all the teaching that you do. It's a pleasure now to invite Dr. Javier Krishnan, who's the South Australian Deputy Chair of the Royal Australian College of General Practitioners, and Javier is going to present the RACGP Prize. Thank you, Javier. So this is, the applications are ranked with a weighting of 50% based on academic merit, results in the final exam, and 50% on their GP supervisor report. This report assesses the student's commitment to general practice, employability, communication, knowledge, and skills. And this year we actually have a winner for both general practice as well as the Rural General Practice Award. And so firstly, the winner for the general practice is Huidet Farm, and he's not here today. So Huey's got 2 prizes that we have to send him by post. And the Rural General Practice Prize recipient is Levi Burgess. Well done, Levi. Thank you, Javier. So the next award is being presented by Mr. Peter Jenkin. He's a nurse practitioner in palliative care at Resthaven Incorporated. And Peter's very kindly come up here to present the Resthaven Palliative Medicine Medal and Prize. And it's given to the final year med student who has demonstrated excellence in palliative medicine during their training in the medical course. And this year's winner is Simon Riddell. Well done, Simon. Thank you, Peter. The next award is actually being awarded to someone who's not here, but I think we should mention it. The Australian and New Zealand Society for Geriatric Medicine South Australia Prize. It's awarded to the student who in Year 5 is recognised for their efforts in geriatric attachment in the program. And it's Abi this year, and he's taken a year off to do honours. So congratulations, Abi. We're going to award that to him next year. The next award is actually in ophthalmology. It's the David Crompton Award, and usually it's presented by Professor John Crompton, AO, but unfortunately John's unable to attend tonight, so I'm going to present this award on his behalf. And John is an apology. So this year's award is actually given to a final year student who undertook a task last year, so is actually an intern this year, and that's Yongmin Lee. Thanks for coming along, Yongmin. So it's my great pleasure to invite now Professor Lucy Walters, my great friend and colleague, who's director of the Adelaide Rural Clinical School, to the stage. And Lucy's going to present the Jonathan Newbury Rural Student Award. And this is the successful recipient of this award will be a well-rounded student who's actively engaged in their community as well as their profession. And this year's award goes to Azamara Walgabriel. Well done, Azamara. Thank you, Lucy. So now I'm inviting Dr. Ingo Weber, who's a State Committee member of the Doctors for the Environment Australia, to present the next award, which is the Anthony McMichael and David Shearman Prize for Excellence in the Public Health Aspects of Sustainability. So this is awarded by the Doctors for the Environment Australia to honour the seminal work in climate change and its impact on human health by former University of Adelaide professors Tony McMichael and David Shearman. And the recipient is a 6-year student who throughout the medical program has contributed most significantly to the cause of sustainability through advocacy, service, education and leadership, Kara Nimon. Thank you very much, Kara. Thanks, Ingo. We do have another special guest whom I didn't mention at the start, and I apologise, Michelle. Dr. Michelle Atchison is the president of the Australian Medical Association of the South Australian branch, and Michelle is a great friend of the university, and I'm always very grateful and happy to see Michelle at events like this. And I'm inviting Michelle to come make a short speech before presenting the AMA Award. Thank you, Michelle.
Thanks, Danny. This is the lovely part of the job with the AMA. One of the other lovely bits of the AMA is that they write speeches for you, so you don't have to think of words. But they've written some words, but what I'd like to say perhaps comes from my heart, and it's a little bit about tribes, so we'll put that aside for the moment. So, and the importance of today. So you're all here, and finding your tribe and the people that you fit with and work with is the most important thing that will happen for you over the next few years. So you've got your tribe behind you, your family and your friends. I mean, they were your first tribe. Now you've got your university tribe, and you know, you'll be able to wear the colours of your university. You know, if you ever get to come in an academic procession, you get to wear them proudly. So these people that you're with at the moment, you know, are such an important part of your life. You'll go on next, you'll go to your intern year, so each of your hospitals will become your tribes, and those people, especially in the dead of night at 2 o'clock in the morning when your page is going off, they will be important people to you. You move on, you start doing your training, and that becomes a really important part of your life. The group that you train with in your chosen specialty, they become lifelong friends, lifelong people that you will stay with, over the course of your career. So then you move into your career, and what you'll find is you start coming back to the tribe that's around you at the moment. So you'll start ringing people in other specialties and say, could you give me some advice, about your patients? And then it starts to be about your family. So they become really important people to you. So the people who are around you, you might lose them for a little bit as you go off to your intern year and you go off to training, but you'll come back to them. And then you kind of move into that last part of your career, and then you retire, as comes to all of us. And these people who you're with today, they stay with you as your tribe, and they'll be, some of these people who are here and around you, they'll be your friends for life. And, this is such an important group of people to be with. So kind of in that spirit, the AMA gives a sense of collaboration as well. We try to be a tribe for everyone. It's a broad community of ideas. We have the common desire to give back to the community, as Danny was saying, to build a health system that provides the healthcare, that your patients and that clinicians deserve. And I hope the AMA, we're the voice of doctors. We talk to government, to policymakers about issues that matter to doctors and to their patients. So it's in that spirit the AMA Award recognises the person in the class of 2022 who has most reflected the goals and principles of the AMA as a medical student. It's partly about their commitment to academic excellence in academic pursuits, but also to their contribution to university life for their colleagues. So this year's winner has already made a significant contribution towards the well-being of their fellow students, creating the Health and Wellbeing Toolbox, can't even speak today, for the Adelaide Medical Students Society, and that won the AMSS Award for the Best New Initiative. This person has had roles as the MedCamp Health and Wellbeing Officer for the AMSS Health and Wellbeing Office. They've been the Australian Medical Students Association Global Health Representative and on the Insight Indigenous Health Subcommittee, as well as the Insight Code Green and Crossing Borders subcommittees. They've been a tutor, a mock OSCE examiner, and have participated in and organised the AMSS APY exchange, and all while achieving strong academic results. So, if you haven't guessed it already, could you please join me in congratulating Ellie Saar?
Now you all get your certificates. It's my great pleasure to invite to the podium Associate Professor Martin Bruning to announce the recipients of the certificates. So the medical school has added a little touch this year that's different from other years. Other than your certificates, you're all going to get a little bit of chocolate.
Is this the new one? Is this the... Okay, good evening, honoured guests, ladies and gentlemen, members of faculty and graduates. I've been given the opportunity by Professor Liu to say a few words tonight before we move to the final official part of the evening. Firstly, congratulations to you all. Well done. Congratulations to all the family members and significant others who have nurtured every one of you in this very significant journey. No doubt many of you on this side of the aisle will be thinking, how can my little son and daughter possibly be ready to be unleashed on an unsuspecting public? Well, look, I'm here to tell you that the marvellous people sitting up here on stage have spent the last 6 years leading your progeny to this point. Safe and competent medical practitioners, without a doubt. Minister Picton will no doubt be happy to hear this. So as Frankie says, relax. For the graduates, I can give you some sage advice, having witnessed the circle of life now for a few times. Work hard, do the best you can. Be nice to everybody, especially to one another. Wash your hands. And if you don't know something, please ask. But above all, as the good book, Hitchhiker's Guide to the Galaxy, says, don't panic. So don't panic. Look, I am fortunate to be involved with the students at the medical school level, then when they become junior doctors, advanced trainees, and then even fellow consultants. Parents, they will be fine. And if you believe in the Ferris-Bueller principle, everything works out. So congratulations to all the graduates. Okay, so I present to you the graduates from the Adelaide Medical School to the degrees of Bachelor of Medicine and Bachelor of Surgery. Samantha Dinali Abegun Arasaka. Tiham Ahmed. Terence Ang. Tasha Arnold. Chelsea Renee Avers. Laura Kate Aliff. Noor Sakina Fikria Azmi and Domenico Barbaro are unfortunately unable to join us today, but we thank them as well. Caitlin May Badone. Nathan Andrew Berent. Ella Bertolis. Dimple Bhatia. Hannah Grace Bransbury. Layla Jasmine Bunjo. Levi Burgess. Ellen Callisto. Matthew Kamash. Angelique Natalie Camilos. Gabrielle Jennifer Capasso. Tinky Chan. Danielle Shanae is unable to join us today. And that leads us to Luzerne Tang Cheng Yai. Leanne Kim Lee Chu and Mayet Tui Cho are both unable to join us today, which leads us to Luke Chalini. Fua Yoi Min Crystal was unable to join us, which means Unkita Das is next. Okay, Imasha Umayagumni Gump Elagay Di Fonseca. Aisha Don't. Casey Donahue. Alexander Duthie. Angela Eagles. Sophie Adelia Eblin. Raylene Swathi Emmanuel. Hakeem Fong. Madeline Jadine Francis is unable to join us today, which means it's Thyson Kalinda Gungay. Nicole Gathard. Christy Lee Gudas. Akash Gowda and Patrick James Graham are both unable to join us today, which leads us to Luke Mario Green. Next is Aishath Hanan. Jaya Yi Heel. An Ting An Hong. Marcus Jared Kiang Jia Hong. Matthew Chan Kit Hong. Yu Wei Huang. Tatiana Hubchenko. Olivia Jeschke. Muskan Jangara. Catherine Jenkins. Tan Wen Po Jonathan is unable to join us today, which leads us to Helena Karapetis. Neha Kasture. Emily Kelsch. Eliza Kennedy. Lachlan Peter Kennedy. Ashna Khalid. Benjamin Koo. Don An Lee Q. Taylor Kilpatrick. Jae-Won Kim. Yi Ji Kim. Matthias Koh. Wee Lang Daniel Koh is unable to join us today, so that leads us to Hei Yong Kelson Kwok. Next is Yong Woo Kwon. Gabrielle Lapalia. Stephanie Layden. Cindy Lamb is unable to join us today, so that leads us to Daniel Langridge. Shanna Lee. Carol Lai. Harrison Lewin is unable to join us today, so that leads us to Sean Jing Ling Liu. Francis Stanislaw Litwin. Bradley Lunay. Eliza Madigan. Ashleigh Laura Maharan is unable to join us today, which leads to Mia Clarice Malagar. Muhammad Danish Manji. Joseph Mann. Law Tahir Mansour. Tanishq Matur. Tapiwa Martivenga. Brianna Carlene Miranda. Lucinda Miller is unable to join us today, which leads us to Aditya Mishra. Florencia Velen Moraga Masson. Alec Campbell Morley. Dylan Morley. Leisha Naikura. Oshada Nanayaka Rawasam is unable to join us today, which leads us to Isabella Jingai Neol. Tess Joanna Newton. Tree Nguyen. Cara Naimon. Madeline O'Brien. Christine Sinju Ong. Tessa Powell. Nikki Panayaris. Subin Park. Kate Louise Parkinson. Li Lin Peng. Udila Chan Wai Peng. Ira Maria Perikath. And Jael Pereira Amaratunga. Antonio Perotta. Hoydat Pham is unable to join us today, so that leads us to Ines Marie Gabriella Portella. Cheyenne Premnat. Alicia Piper. Mahima Sarah Raju. Neve Rees is unable to join us today, so that leads us to Luke Regsk. Simon Riddle. And Grace Roach. Rosie Annabelle Robinson. Peter Rossi. Huda Riaz Patel is unable to join us today, which leads us to Ahad Ismam Sabab. Jessica Sash. Eleanor Saar. Meg Schultz. Janaea Shelton. Stephen Shee. Fatah Shohani. Sridhanya Sri Krishna Bala. Emily Slimming. Joshua Smith. Dominic James Spicer. Mark Serejovic. Nithya Sukhija. And Holly Sunners. Edward Sutanda, Kunwa Talwa and Daniel Tan are unable to join us today, which leads us to Kim Valerie All-Day Tan. Kevin Tang. Claire Elena Taranto. Morella Pierre Taylor. Alina T. Olivia Tay. Fiona Toy. Ethne Bridget Tobin. Andrew Tong. Georgina Trotter. Jeremy Tu. Theodore Nicholas Velkos. Isabella Vinci. Amanda Vu. Peng Nang Wang and Chi Ka Wee are both unable to join us today, which leads us to Michael Wei. Rowan Wheaton. Erin Widdowson. Asmara Yulma Wald-Gabriel. Lung Hai Alexis Wong and Noah Wai Kang Wong are both unable to join us today, which leads us to Roy Wong. Ven Wu. Sophie Woods. Lee Jia Sin. Nimriki Ashariya Yapa. Yi Ling Yong and John Yeon Yoon are both unable to join us today, which leads us to Kirili Zaka. Shan Zhao is unable to join us today. So this concludes the graduates from the Adelaide Medical School for this ceremony. Thank you.
Hey guys, before I let you go, just a few thank yous if I may. Thank you to colleagues, making my job so enjoyable. Thank you to the sponsors of tonight's awards, the event organisers working furiously behind the scenes, and the organist, Professor Greg Crawford, who's gone up there, is on his way up there. It gives me great pleasure, guys, to congratulate all of the new graduates here today. Be proud of what you've worked to achieve. Remember those who've supported you to reach this end. I wish you every success as you enter this next exciting stage of your life and career. You've been told before, look after yourselves, look after each other, stay humble. As graduates of the University of Adelaide, you are also its alumni, and we hope that you will keep in touch with the university. You will join nearly 150,000 alumni from this university. So as the last gesture, I've got some leftover chocolates today, so I'm going to throw it out to you guys. I was so keen to get ahead of myself to chuck chocolates around, guys. I had forgotten that we haven't even done the declaration yet. Can I have those chocolates back? Hey guys, thank you, Martin, for doing the reading out of all the names. So it gives me great pleasure now to invite back to the stage Cara, the winner of the ACMA Prize, to lead the graduates in reading the declaration. So please stand and read along with Cara when she's here.
I will now begin. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will protect my profession with conscience and dignity and in accordance with good medical practice. I will foster the honour and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honour.
Thank you, Cara. Thank you, guys. So what I said 5 minutes ago, that again. Guys, I ask the graduates to remain seated, please, and I invite everyone else here today to stand. And once again, join me in congratulating the graduates 2022. So the audience, please remain standing, and invite the graduates, please, if you don't mind standing as well for the academic recession. Thank you all.